Welcome to another video for National Rehabilitation Awareness Week, where we are taking time to get to know some of our rehabilitation team here at Mary Free Bed and across the system. We're going to chat now with Dr. Adam Lamm, get to know a little bit more about physiatry and the medical group at Mary Free Bed. Dr. Lamm, thank you so much for joining us on the call today.
Of course, thanks for having me.
So just big question here before we even really start, like, what is rehabilitation? We've heard about it. We might think of physical therapy, but how would you define rehabilitation?
I think rehabilitation is one of those kind of hard to define pieces in healthcare. I think one of the ways that I kind of try to explain it to patients is it's trying to take wherever you're at, where maybe you're not able to do something or you're not able to achieve a goal and trying to work towards it. So in some ways, it's a very goal directed, trying to improve function, improving quality of life. And so for someone with maybe an acute bone or joint injury, it's trying to work on getting back to activities without having pain. For a patient with a brain injury, that might be getting back to more cognitive tasks and day-to-day activities. So it can look very different, but I would say that in broad strokes, it's trying to restore function and quality of life in any number of different ways.
And I skipped the most important question. I was going to ask you just to kind of introduce yourself, your role here. You've been at Mary Free Bed for a couple of years. Tell me a little bit about what you do and some of the patients that you see here at the hospital.
Sure. So I'm a brain injury physiatrist. I joined Mary Free Bed kind of in the summer and fall of 2020. So been here for several years now, working in brain injury. So predominantly outpatient, but I do some inpatient and consultative work as well. In addition, I'm also the residency program director, and so helping to oversee the training and education of our newly minted doctors who are wanting to go into rehabilitation medicine. So I get to wear a couple different hats on a day-to-day basis.
So for someone who it's a new patient, they just came into the hospital and they hear, wait, I've got a psychiatrist coming, a physiatrist coming to see me. Like, how would you define like PM&R and physiatry?
Yeah, so PM&R, physical medicine, and rehabilitation or physiatry are kind of interchangeable terms. They both are, I think, a little bit confusing. And so I usually try to kind of describe to patients I'm not a psychiatrist, although we sometimes work with them, or I'm not a neurologist, although we definitely work with them, or I'm not a surgeon, but we work with them. Really, the physiatrist is a rehabilitation doctor. And so our role is to help oversee your recovery, whether that's inpatient or outpatient, and really trying to kind of serve as the leader of that rehabilitation team. And so somebody who's had an injury or something's happened to them, we'll try and assemble what team members are needed to help get this person back to their highest quality of life and function. For us, that's often physical therapy or occupational therapy or speech therapy, recreational therapy, vocational therapists, psychology, psychiatry, coordinating with other specialists at other hospitals, nutrition, dietitian, nursing, case management. There's a whole list of team members. And so we're kind of that combination of quarterback and coach of the rehab team, I think is really kind of the way to think about what a rehab physician is.
Yeah, and that's been interesting as I talk with so many people throughout this week of National Rehab Week and getting to know their pieces in the puzzle of a person's recovery. That's interesting way to say it, like a quarterback of the team, like kind of or looking at through big picture. So a physician will work with them at the beginning of their inpatient stay, but then see them throughout outpatient and then do like follow-ups with that. So, and then you mainly work on the outpatient side, correct?
That's correct, yes.
So how would you be working with a patient? Like maybe pick one of the examples, because you said, you worked with concussion in brain injury. Like what is a typical type of patient and their involvement in working with you?
So I would say I tend to see two different main groups of patients, one being those that come through our inpatient unit, and then as they're recovering function and getting better, they're ready to graduate from our inpatient unit and heading home. One of the things that we always say is that the getting better and the recovery doesn't stop the minute that you leave our hospital. It continues at home. It continues on outpatient. And so there's some new challenges and new obstacles that come up with that return to home. Maybe some of the things that we thought were going to be easier are a little bit harder, or sometimes the road to recovery may be a little bit of a winding path. And so our job on the outpatient side is to kind of help continue to transition people transition them back to return to work if that's appropriate, return to driving. And so that's kind of one patient that I see. And then on the concussion side is a little bit different, is that's somebody who may have gone to the emergency department or urgent care, but didn't come through our inpatient unit.
Mm.
And so their care is predominantly almost entirely outpatient. And so there it may be things more like headache management, pain management, trying to get people working on their dizziness and balance symptoms, getting them connected with our post-concussion rehabilitation team. And so there's some components of both that are similar in that it's kind of symptom-based, impairment-based, and kind of leading the rehab team. But the type of patient and the challenges that they face in both of those are a little bit different.
Have you had any recent success stories that like really fill you up and just make you happy to be doing the work that you do?
I think that that's one of the nice things about what I get to do in brain injury, and kind of straddling that brain injury and concussion side. We tend to have a fair number of success stories kind of on both. The concussion recovery, just by nature of the injury, the recovery is a little bit faster. And so the rewards are a little bit faster. But I think on the brain injured side for kind of the more severe patients, there's a longer payoff. And so the reward is different, but you kind of get that sense of kind of when you win a marathon as opposed to winning a sprint. It kind of feels different when you cross the finish line. So we've had some patients recently who had pretty significant injuries, who are starting to make big transitions back into their lives, their roles as husbands or fathers or mothers and employees, and really getting back to the things that help make us who we are. And I think that's really the most rewarding part of it.
And I bet it's been great. You get to share some of that rewarding ness of the field with new people who are coming in to work in rehabilitation. You've been leading the physical medicine rehabilitation, our residency program. What has that been like for you?
I think that's one of the most both challenging but rewarding pieces of what I get to do, because you're taking newly minted doctors who want to go into rehab and want to learn about the field and make this their career. And you're at kind of the ground level of setting what those habits that they're going to use for the rest of their lives are. And so I think that's one of the really great things that we get to do. Our residents, I think, are really phenomenal people as a group. They spend time on both our inpatient unit and our outpatient clinics. And so they really get to see all of what Mary Free Bed is and all of what rehabilitation is in their 3 years with us for training.
How did you get into the field? What inspired you to go into to be a physiatrist?
So I was a little bit of a kind of unique story in that we have a family member who is a physiatrist, kind of worked more in the spine outpatient musculoskeletal setting. And that's kind of what I thought that I was going to do. And then once I kind of went to medical school, still knew that I wanted to do physiatry. It felt very rewarding to me every time that I shadowed him and spent time with him. But once I kind of got into residency training, brain injury really kind of stuck out to me because there's a lot of diversity in what I get to do. I can practice on the inpatient side, outpatient side, consult visits at our major hospitals. And so I get to wear a lot of different hats in brain injury. And that was something that I didn't think would be what I wanted to do. But once I got a taste of it in training, I really realized I didn't want to kind of commit and stick to just one aspect of kind of the spectrum of care. Brain injury allows me to do that.
Awesome. Well, Dr. Lamm, thank you so much for doing this interview. Last question before we wrap up. If someone who's maybe thinking about going into physical medicine, wanting to be a rehab doctor, what would you say to them to encourage them to go into it? Or just maybe even somebody else wanting to come work here at Mary Free Bed? Why should they do that?
I think it's a really rewarding career. I think you can do a lot of really great things with your life and in healthcare and a number of different fields, even beyond healthcare. I think rehab's really special in that you get to work with a patient population that is very much in need, and very highly motivated for getting back to the things that they want to do. And as a practitioner, that's a really nice patient population to work with, is somebody who needs you and somebody who's really driven every day to put in the work to get better. And so we really partner with our patients to help them achieve their goals. So I think it's definitely worth pursuing. If you're wanting to learn more about us, you can check out our website. It has a lot of information about the Mary Free Bed PM&R residency. If you're a medical student, there's a lot of information about potentially coming and spending some time with us as a medical student. And if you're even earlier on in your training, give some good ideas and tips and tricks on how to learn a little bit more about the field. So would definitely direct you to our website for both the medical student experience and residency experience, and also just about our hospital to learn more about us.
Yeah, awesome. Well, thank you very much for that, Dr. Lamm. Thank you for joining us. This has been another video, part of the National Rehabilitation Awareness Week, getting to meet the team. And just like Dr. Lamm said, if you want more information about Mary Free Bed, go to maryfreebed.com. You can search careers there. You can search for residency program, or even just coming to visit or volunteer. So stay tuned for more videos this week. You can jump back into your social feed to check them out. Thank you so much, and let's continue to celebrate rehabilitation during National Rehabilitation Awareness.